Okay, so I'm here again with my friend Dr. Jorge Palacios, and we are going to continue with another interview or conversation. Really, it's more like a conversation we're having because we talk about some of these things other times, but this time we just decide to share some of it with other people, so other people can hopefully learn something from the discussions. So today we're going to talk about chronic pain. We've talked about traumatic brain injury in the past, and today we want to continue with one of the other subjects that we've been talking about. So chronic pain. First of all, uh, I wanted to just ask you to, in your words, to just define when we say chronic pain. How is that different from when someone just says pain?
Well, the difference is just the time that the pain has last. That's the main difference. Mm, Many experts from the field agree that when the pain lasts more than 3 weeks and it is present between 3 and 6 weeks, we can start talking about chronic pain.
Okay.
Most of the pains just are present in the acute moment of the illness.
Hmm.
But when it lasts more time, then it can be labeled as chronic pain.
Okay. Thank you. And how big is the problem of chronic pain?
Well, it is big, big problem. Just um, there are a lot of numbers that really scare not only the people not, that is suffering from chronic pain, but also the specialists that are working with chronic pain. Because when you see these figures, these numbers, you start thinking, who is going to do all this job? Who is
Mm.
going to work with all these problems? For example, if we are talking about headaches, the estimated population that suffers from headaches is about the 10% of the world population.
Mm.
The 10%, I can imagine that.
Mm.
But if we are talking about chronic pain in general, the numbers from 2011, 2012 are about 116 million US adults
Mm.
suffering from different types of chronic pains. In the case of, for example, fibromyalgia, there are an estimate about 6 million women suffering from this type of pain in the US. Neuropathic pain, which is almost and all the time related to diabetes, for example, it is estimated that the 26% of the population in the US is suffering of neuropathic pain.
Mm.
So, as you can see, there are a lot of figures, of numbers related to chronic pain in its different forms.
Mm.
Considering also that it is also underestimated and underdiagnosed.
Mhm.
So, if we consider these two points, we can start thinking that there are more cases
Mhm.
of chronic pain of different types.
Right. And what would you say are some of the more important types of chronic pain syndromes?
Well, of course, chronic headaches of different types. You know, the international work done many years ago, auspiciated by journal, the international journal named Cephalalgia. Um, it was a special work to determine the different type of headaches. Well, in this case, the research came out with about 150 different types of headaches.
Hmm.
From those, we can mention two, two that are related to us mainly because of the work in biofeedback and neurofeedback, and they are migraine headaches and tension type headaches,
Hmm.
which are a special category, which is very important because of the prevalence. It's supposed that the 10% of the whole group of headaches categories is only attributed to migraines.
Hmm.
Migraine headache, which is a lot, and there are 14 different types of migraine headaches.
Wow.
So you can imagine there's a lot of work to do there,
Sure.
and almost, almost, I would say that the most important point here is that all the headache migraines are not always responding to medicine. There are a lot of drugs that are used to treat migraines, but they are only used to treat the acute episode, but not the illness in
Hmm.
itself.
Hmm.
And since it is a genetic disease,
Hmm.
you can imagine that it is growing all the time because the population is growing, and there are a lot of cases all the time, and there are a lot of dependence to painkillers
Hmm.
in general, but specifically in migraine headaches.
Right.
And the other type, which is tension type, it is also a big, an important problem. I have seen patients with 40 years of
Wow.
suffering tension type headaches. That's a lot of time. The other type of chronic pain that is very important is dysmenorrhea. Dysmenorrhea is an important problem also, and it is underdiagnosed. It is underdiagnosed.
That
Uh,
leads to another question as far as why do you think that the pains are underdiagnosed and undertreated? Maybe that's
well,
connected to what you were just talking about.
Well, this is not my words. These are words from the American Neurological Association. They conduct a survey in different health settings, and all the people that they interview agree that they are not properly trained to diagnose or treat
Hmm.
chronic pain.
Hmm.
So that's one of the main reasons
Hmm.
why chronic pain is so underdiagnosed and undertreated. The other point is that many people doesn't go to the healthcare setting, to the hospitals, to the clinics to receive proper treatment because they think, well, this is the way I am. This is just a chronic pain, like my father, like my aunt, like my mother, like my grandmother. So I have to deal with this, and I have to suffer with this. And another point, which is most important, is that many people has a secondary winning with the chronic pain because there are a lot of days off work, and they are paying the insurances companies, or maybe the employers are paying for those days, and
Hmm.
people are not going to work
Hmm.
because they are having a pain.
Hmm.
So there are several reasons about this point of being underdiagnosed, undertreated. Some part is related to the healthcare system, and other part is related to the people that is suffering from headache. An important point here also I want to also address is, and it has been mentioned in a lot of articles in New York Times, for example, is that the drug dependency,
Hmm.
the dependency to painkillers is a very big issue.
Hmm.
So many people prefer to take the painkillers to feel okay, not only because they have less pain, because they also feel better
Mm-hmm.
emotionally, we can say, and that's another reason they do not go to the proper setting to be treated for the pain.
Mm-hmm. Now, would you say that the dependency is the most important or the biggest problem with painkillers, or is there something else that's a bigger problem?
Well, the dependency, I do believe, is the big problem, but I think there's two type of dependency.
Mm-hmm.
One type is the effect. The drug killers, in fact, they have an effect. People feel better,
Mm-hmm.
but physically feel better.
Mm-hmm.
The pain goes away.
Mm-hmm.
But the other point is the emotional dependency,
Uh-huh.
because there are narcotic
Right.
painkillers, and they are with an important effect in the emotion. So people start feeling better, and they say, well, I can take the pill and feel better in both ways.
Mm-hmm.
My emotions are feeling better, and also my pain is gone. So both type of dependencies are important, and there's also a passive position here,
Mm-hmm.
because the people hasn't to do anything. They are suffering from the pain. They took the pill and they continue with their lives,
Mm-hmm.
instead of other type of indication, medical indication, our indication in neurosciences field. You have to change your lifestyle, you have to change your habits, you have to do some kind of exercise, you have to go to neurofeedback, to biofeedback sessions, and there's a lot of work to do, and they prefer to take the pill, and that's all.
Uh-huh. Uh-huh. Right.
So that's an important point we have to consider. In fact, there are some new restrictions since the last year. I don't remember, maybe in November. FDA published new restrictions for painkillers.
Mm. And
Bec-
what are some of the main points about that?
Well, the main point is that they cause more dependency, that they are related to narcotic type of painkillers, that some of them are, they don't need a prescription.
Mm.
In fact, there's, I don't remember the name, but there's an important drugstore in the US that is planning to stop selling painkillers,
Wow.
because, well, it is a big business, but also it is a big responsibility, and they are considering to stop selling it, because they don't have to be into trouble when it comes to a bigger issue.
Mm-hmm.
So those are, well, of course, if the painkillers are sold without prescription, then the prescription comes mouth to mouth, one people to another. I
Right.
am a chronic pain sufferer, and I have some good results with this painkiller. Take it. I recommend it to you.
Right.
So the problem is getting bigger, and the main point here is that the real problem, which is the chronic pain,
Mm-hmm.
continue getting more chronic.
So whatever the source of the pain is not really being dealt with, and it's more just dealing with the symptoms, sort of covering up the symptoms, and so the problem continues.
Dealing with the symptoms, yes, you're right, and also creating new health
Right.
problems.
Now, can you just describe how biofeedback and neurofeedback is used, like what the protocols are for some of the basic protocols for working with chronic pain patients?
Well, yes. Fortunately for us, for you and me, and for the people that is working in the field, there are a lot of protocols. We can describe some basic protocols. For example, in the field of biofeedback, we have to deal first with arousal
Mm-hmm.
and with the reaction of the autonomic nervous system, which is an important way of controlling the pain route, the pain field to be established in a moment, in a precise moment. So when you are dealing with a patient with a chronic pain, you have to train him to deal with the arousal in general, not related only to pain, but in general. That's one important point. If you have chronic pain related to muscular tension, chronic muscular tension, well, there's a lot of work to do because people is going to be trained in control the chronic contraction of certain type of muscles that are causing the pain. That's the case of chronic tension type headaches. If you have a specific pains, like for example migraine, then well, there's a lot of work to do because first in the field of biofeedback, people has to be trained in raising and keeping in some point that it is more or less 91, 92, up to 96 Fahrenheit degrees, the temperatures in the hand. That will assure to have a proper circulation, not only in the hands, but all over the body. And that is going to be a good way to prevent the migraine crisis to begin. Because all the migraine crises start with vasoconstriction all over the body, but mainly in the main arteries of the brain, in the meningeal area, which they causes the most important pain. So people can be trained to prevent the migraine crisis and also to abort the migraine crisis when it is starting. Um, if you train people with biofeedback in profound relaxation, well, that's a very good way to deal with chronic pain of different types because brain, when it is in deep relaxation, starts in certain type of self-analgesia of the pain. You know, neuropeptides are changing. P substance, which is the mediator, the neurotransmitter of pain, is dropping down. So the whole syndrome of chronic pain is being controlled by those means. There are certain type of chronic pains that can be controlled also by training the patient or the client to control the diaphragmatic respiration. In this case, they can assure a proper circulation, body blood flow circulation, and also they can prevent this particular moment when the blood vessels are in constriction, which is related to chronic pain or to pain only as a natural response. So there are certain types, for example, the low back pain, which is related to tension, muscular tension, which is also restricting the blood vessels to make the blood flow. And if and there are the main response when there's not enough blood in certain part of the body is pain. The natural response is pain. So if we train people to control the respiration, they can do a better job with the blood flow all over the body and to assure the proper distribution of blood in all the important parts of the body, but mainly in those which have this problem of muscular contraction with blood vessels constriction. That's with biofeedback, and that's a lot of work.
Right. Uh-huh.
And also with neurofeedback, well, with neurofeedback, there have been identified different types of brain waves related to pain. For example, we have slow waves, theta waves in the sensory motor cortex, which are related to chronic pain. There are neurophysiological markers of chronic pain. Then the training has to be to modify this kind of neurophysiological markers of pain, and to try to train the patient to do a lot of SMR activity
Mm-hmm.
instead of this type of theta waves, which are a special type of theta waves.
Mm-hmm.
They are also the alpha activity, which has been related to the analgesia state of the brain, and also to um, uh, train the patient to do less beta 2 and beta 3 activity in the frontal lobes,
Mm-hmm.
which is also related to this type of anxiety
Mm-hmm.
related to chronic pain.
Mm-hmm.
And if you joined all this type of training, well, then you have a success with the patients.
Mm-hmm.
It's a lot of work, and it's different because some patients start to create dependency, in this case to neurofeedback or to biofeedback or to the therapists, and
Uh-huh.
it's difficult.
Uh-huh.
It's difficult, the chronic pain syndrome.
Uh-huh. So it sounds like there is a lot to it, a lot that can be done and needs to be done with someone who is suffering with chronic pain, but it does offer an alternative to some of the other treatments like the medications, which you mentioned about some of the problems that are related to that, and also in some cases there's surgery too, and I've heard of many instances where someone had back surgery and they didn't even feel any relief afterwards, and sometimes there may have been some other things that could have been at least uh, tried before the surgeries.
Yes, you see, for chronic, for low back pain, I have treated patients that have had about 7 surgeries,
Mm. Wow.
and they haven't found results.
Hmm.
One point important with neurofeedback and with biofeedback is that the procedures really solve the problem. They are, of course, not invasive,
Hmm.
and if they are managed properly, the patient recovers the
Hmm.
independent
Hmm.
life and the productive
Hmm.
life. And also, it can be they can deal with depression related to chronic pain,
Right.
so they can overcome all the syndrome complete.
Right.
And in a few sessions, we can say that biofeedback and neurofeedback really solve the problem of chronic pain.
Right. Right.
It's a lot of work for the therapist, but it is a very good solution.
Yes, and I'm sure when you have positive results with clients, it seems all to be worth it.
Yes, it is. Yes, it
Yeah.
is. It is. Yes, maybe in another occasion we can discuss about the specific procedures, because, as you can see, I mentioned all the procedures, but each one deserves its time.
Well, and also I know that of course this is mainly a discussion just to kind of talk about it a bit, but you also are doing a series of webinars and seminars that some of which would be dealing with chronic pain, and the information on these trainings will be available on your website and my
Mhm.
website. So if people want more information on those, they can contact look at the website, and they can contact either you or me, and get more information on it. So just I'll put the information at the end of the video, but just tell us what your contact information is.
Yes, of course. Well, my website, it is www.biofeedbackcentermr.com. And well, they can see all this information related to pain treatment. And there are also my contact numbers there. But all people interested can also reach me at Jorge Palacios at biofeedbackcentermr.com, or also another address which is more simple. It's is Jorge Palacios at me.com, which is also an address where they can contact me.
Right, and you're also on LinkedIn as well, right?
Yes,
Yes.
I'm also on LinkedIn. Yes,
Right.
yes. I'm not all the time. That's
Right.
I forgot about it, but yes,
Yes.
I'm also on
Right.
LinkedIn.
Okay,
Yes.
well, it's great talking to you again, and we'll I think the next time we talk, we'll cover some information on PTSD.
Okay. As usual, Harry, it is my pleasure.
All right, thanks again.
You're
All
welcome.
right.